because of outbreak. Oh, thank you, Jesus. Outbreaks in 2025. Outbreaks in 2025. Kora andra bahasto brein edovras tikeshta ada. Farah andra us. We have to pray against outbreaks and medical outbreaks. So they'll say there's an outbreak of this, outbreak of this, outbreak of this. Some of them, not even, I'm not talking about new strains of diseases and all that. Yes, that is on one side. But I'm saying even things like, say, outbreak of tuberculosis, for instance, just an example, or outbreak.
We begin with the state at the center of an unprecedented tuberculosis outbreak. Kansas is reporting the largest documented number of cases. Eva Pilgrim has the latest developments. And Eva, this is, of course, an ongoing situation, so there's concern that there could be more cases. Good morning.
That's exactly right, Robin. This is an active outbreak, and health officials expect there could be more cases. It is the most deadly infectious disease in the world, but it hasn't been a major concern here in the U.S. for many decades, until now.
This morning, health officials in Kansas are dealing with the largest documented outbreak of tuberculosis in U.S. history. There have been 2 deaths along with 67 active cases. TB is one of the world's leading infectious disease killer and is spread person to person by germs that can stay in the air for hours.
You do need prolonged contact with an infected individual. You know, if you briefly come into contact with somebody in the community, it's not very likely that you're going to contract tuberculosis. The exact reason for this specific outbreak is not yet clear.
Kansas public health officials found dozens more have latent TB, meaning they are infected with the TB bacteria, but they do not have symptoms and cannot spread the infection to others. While TB rates in the United States have been declining since the early 90s, including by nearly 20% during the first year of COVID, rates began climbing in 2021 and 2022, surpassing pre-pandemic levels in 2023.
Now, there is a TB vaccine that leaves a little circular scar. It is commonly given to kids in countries where TB is common, but it hasn't been commonly used here in the U.S. because historically the numbers here, y'all, have been so very low.
I know, that's what is so concerning. So we're going to have much more a little bit later because Dr. Narula is going to be here because there are a lot of questions. Thank you, Eva.